Good morning, everybody. Good afternoon, everybody. We're going to give it 1 or 2 more minutes to let people come in, and then we'll start the webinar promptly at 9:01, 9:02. Thank you for joining us today. Good morning, good afternoon to the new people that are joining. We will start the webinar promptly at 9:02. We'll get some people a couple minutes to log in. Thanks. Okay, welcome everybody to the third installment of the AHIA African Biomedical Innovator Series. This webinar theme for this morning, this afternoon, wherever you are, is Innovation Not Aid, Stories of African-Led Healthcare Innovations. And so I want to present AHIA to you, in case this is one of our first webinars that you're joining for us today. AHIA stands for Advancing Healthcare Innovation in Africa, and it's an interdisciplinary program of Emory University in Atlanta, Georgia. AHIA's whole mission is to support translational research, which is lab to market innovation in Africa through training, mentorship, and providing access to networks and nations that work towards building out solutions for healthcare needs throughout Africa. And we typically host an annual in-person accelerator program every summer in South Africa. But due to COVID, we've moved our programs to the digital world. And we're excited to reach a whole new audience across the continent of Africa and across the world. This webinar series serves as one of the aspects of our growing resources, which is education and network building. And we're so excited to have you here on our third one. So welcome. And let's give you a special thanks to a few people or a few entities. Africa Bio is our partner in today's webinar series, or in our webinar series. And Africa Bio, I'll give a couple minutes to explain what Africa Bio is. It's a biotechnology stakeholder association, and the purpose of Africa Bio is to facilitate training, education, research, and development of biotechnology across Africa. The organization aims to provide a single voice to address policy and decision makers while providing accurate information on biotechnology and the public. And every year they host the annual BioAfrica convention. In 2020, the convention hosted over 1,200 registered delegates across 52 countries. And in partnership with AHIA, the convention launched the Bioaxa Innovation Hub, a digital ecosystem to support biotechnology innovation and industry in Africa. We are incredibly excited about the partnership with Africa Bio and the continuation of this series, so thank you. And yes, feel free to put where you're logging in from this morning or afternoon, your name, anything that you want in the chat. It should be really interactive. Okay, so next I would love to present our moderator for this webinar event today. Yes, thank you. Amelia Schaffner. So Amelia is the director of and co-founder of Goizueta Emory Center for Entrepreneurship and Innovation. She's responsible for developing the school's entrepreneurial culture, thinking, initiatives, partners, and partnering with students, faculty, alumni, and the ecosystem of investors, VCs, and organizations. She's involved with a number of and extracurricular initiatives, including the Pitch Professors program at Emory Goizueta, the Raise Funding Forum, the Emory Startup Launch Accelerator, Emory's AHIA's, of course, Advancing Healthcare Innovation in Africa program, the ecosystem partnerships across Atlanta, Georgia, and really the world. She's a great networker and connector, and is a frequent mentor to founders. Previously, Amelia was a senior principal at Adventure, where she led a global innovation initiative. So with that, I will pass it over to our moderator, Amelia, who will present the center and also will introduce all of our panelists for today. Thank you.
Great. Thank you, Angela, for a great introduction. It's a pleasure to be with all of you. Good evening, good afternoon, or good evening, wherever you are. Yes, the Center for Entrepreneurship and Innovation really has three main priorities. We focus on fostering entrepreneurs that are building their own companies. We focus on those who fund those entrepreneurs, so early stage investors, and lastly, the corporate innovation. So we're actually in interdisciplinary initiatives like AHIA fall into. So initiatives that help support innovation and a number of different verticals. In particular, AHIA is in the healthcare vertical. It's a pleasure to be here. Today we have three fantastic innovators that join us from Africa, and they have all been through the AHIA program, the symposium. And we have today Dr. Adreni Abiyandoun, who joins us from Nigeria. He is a social entrepreneur and innovator who is committed to improving maternal and infant health in Nigeria and Africa as a whole. He's the founder and CEO of Help Mom, a social enterprise that uses the power of mobile technology and low-cost innovations to improve maternal and infant health in Africa. He has received a number of different awards, and including the Google Impact Challenge and the Facebook Community Accelerator Winner Award. We also are joined by Sesinam Dadagu, who's joining us actually from Ghana. And he is actually the founder of Snoocode. Before returning to Ghana, Sesinam, who goes by Ses, was working with the British Metropolitan Police under the Digital and Electronics and Forensics Services, very impressive, where he built cutting-edge electronic tools and works on some of the most high-profile cases in modern history. So he has a background in technology, and that's where the founding of Snoocode came in, which is a 6 to 7 digit code to save addresses when you don't have internet or cell access. He was born in Accra and previously lived in Israel and London, and he basically goes between Ghana and London. He also holds a engineering degree from Warwick University. And lastly but not least, we're joined by Dr. Conrad Tanku, who is a young and dynamic medical doctor from Cameroon. He's a technology enthusiast who passionately believes that most of the health challenges in Africa can be solved through technology solutions, which are adapted to the African context. He founded GIC Space. It's a social venture which designs and promotes cutting-edge and cost-effective solutions for health challenges in sub-Saharan Africa. And with his experience in technology and medical practice, he hopes to be a pillar in ensuring that remote communities enjoy affordable healthcare. So I want to welcome all three of you. Thank you so much for being here. What we will do first for the audience is we will go through each individual innovator and hear a little bit of their journey and their story. And then we can go into more general questions that lead into the topic of the day, which is innovation and not aid. So let's start off with Dr. Abiyandoun. If you can tell us a little bit about your journey leading into AHIA and where you are in terms of innovation with your Help Mom.
Yeah, so thank you very much. I started, for me, I like I say all the time, I started Help Mom when I was in school. I was in medical school when I started Help Mom. And at that point in time was just out of passion because of the data I saw on how pregnant women lose their life to things that can be preventable. And after I started Help Mom when I was in school, it was a little bit kind of tough. And why was it so tough? Was because of the fact that, we were doing a lot of great things, but there was no sustainability vehicle to what we were doing, and we didn't have any form of funding. And so luckily for us, we were able to get selected for a program for an hackathon in Nairobi, which I went to Nairobi. Then I was still in school, and I won the hackathon. So after I won the hackathon, the idea I pitched at the hackathon was we wanted, because when we started Help Mom initially, we were providing free healthcare services. But when we won the hackathon, the idea I pitched was that I wanted to be providing delivery kits, what women use for delivery. I wanted to be providing it to them in a bag. And so it was so fantastic. They liked the idea, and I was selected. And that kind of gave me a validation that this will work. And after that, we got some little funding from Western Union. After that, we got some little funding from Western Union and the likes. And that was when I got into AHIA. When I got into the program, can you hear me? I think I'm getting low. Yeah. So when I got into the program, then we, can you hear me?
Yes.
Can you hear me? Yeah. So after we got into AHIA, that was the time I applied for Google Impact Challenge, and that was when we got selected. We got to the semi-final stage. We got to the final stage. We pitched and we were selected. We got $250,000 in funding from Google, and that was what changed everything for us. So from changing everything for us, from having a proper team, from being able to now operate properly as a company because we have enough funding to do that. And also, we also had the backing of Google. Google was also working with us to improve on our technology, and a lot of good things started happening. And afterwards, we got funding from Facebook also through the Facebook Community Accelerator Program. And even when we were at the Accelerator Program, after the end of the Accelerator Program, we still got additional funding because Facebook really liked what we are doing. And at the moment now, with our innovation, we are actually venturing into AI. So we've already done a lot of incredible work using normal technology for our vaccination tracking system, for building an e-learning platform. Now we want to see how we can use AI for social good. And funny enough, coincidentally, 2 days ago, we just got into a new partnership with Google AI to develop new product for vaccination tracking in Nigeria and etc. So, and that's the first, and that kind of partnership is even the first to even happen between Google AI and any form of entity in Nigeria so far. So, I mean, for us now, like you said, what is the stage of our innovation now? The stage of our innovation now is building new product. We are still going to continue with what we are doing, but we now want to start building new product that will be very beneficial to people and will be used for a lot of social good and can really scale faster and better to other countries. Thank you.
Thank you, Dr. Abiyandoun. And can you talk a little bit about the impact, that the combination of these awards and the process of coming through AHIA and learning about, IP, commercialization, et cetera. Can you talk about the impact that all of these programs have had on forwarding sort of like the Help Mom?
Yeah, so to be very honest, before I got into AHIA, I've not really done any proper program that will really take you through on how you can build products, on commercialization, on IP. I mean, it was in AHIA I had about IP. That I had a proper course. Like I can remember Professor, I can't remember his name now. He was one that took the session on IP then, and all those training actually made it a fundamental knowledge for me to know how we can really go about really building the company for long-term success. So, I mean, AHIA came at the right time because 4 months after we got AHIA, 4 months after I got into AHIA was when I got Google Impact Challenge, just 4 months after. And even 4 months after I got into AHIA was when I was also selected for a funding opportunity by United Nations in Geneva, which I also won. So the AHIA created a fundamental of knowledge. Even though AHIA didn't give money, they created a fundamental of knowledge that actually helped us on our long-term success and thinking about innovation. I mean, it was when I was in AHIA and I met some of the students, because AHIA is a kind of partnership where they bring students, you interact with them. And I remember when I was some of the students that worked with me on my project, and we were talking, and one of them asked me one question. She was like, "But where do you see this in the next 10 years?" And it was a question I couldn't really answer then, because for me, I know that just doing all these things might not really take us, or might not really make us sustainable, might not really make us relevant in the next 10 years. So for me, I started looking in depth, like, oh, how can we have products that can stand the test of time and that can be used and that can scale? And it was after I left AHIA, I developed our proper vaccination tracking system, which has over 50,000 nursing mothers currently, and can be scaled anywhere in the world. And it was then I started thinking about what are the other things we can do that we can use to have long-lasting impact on mothers and children in Nigeria. And that has led us to every single thing we do now at Help Mom and the partnership we keep getting from reputable companies.
Fantastic. Thank you so much, Dr. Abiyandoun. We're going to now move into and talk a little bit also with Ses Dagadu, but we'll get back to you, of course, because we have more questions for you. Thank you so much. Ses, do you want to share with us your journey, before, during, after AHIA, and, a little bit of where you are with SNUCode?
Hello. Thank you. Can you hear me?
Yes.
Okay. Yeah, so SNUCode started a couple of years ago, well, quite a long time ago now, when I was in Ghana, and the basic idea was to give people in the developing world an address. You often hear that there's a sort of dearth of data when trying to solve problems in Africa. So we started from a more fundamental level where we are trying to give people the means to create that data, specifically location data. In the long run, it's evolved into SNUCode Red, which is our specific version of the software for the use in healthcare, whether it be public health, emergency medicine, or any other thing related to health. We did the AHIA program in, I think it was in like 2017, if I remember correctly. And it was really impactful because this was the first time that myself and my investors at the time started to consider things like intellectual property and its importance to the future sustainability of the business. And so that was a key turning point, getting myself and my investors to think about the protection of intellectual property, and related things. I'm really sorry I'm bad with names, but one of the highlights of the program was meeting one of the researchers from Emory who was responsible for the treatment for hepatitis. I think it was hepatitis C. So I know a few people, which is kind of funny because I know a few people from back in secondary school who either themselves or in one particular case, their brother who was treated with tenofovir. So that was a big highlight for me for the program. So today's SNUCode covers the whole of Africa, South America, the Middle East, and 70% of Asia. We currently have a drive on to map every sort of healthcare facility in Africa. We just yesterday crossed the 60,000 mark. So we now have the locations of 60,000 clinics, hospitals, and pharmacies. And yeah, and SNUCODE is able to help you leverage those to provide healthcare in any condition or in any situations across the continent. As I said, we also use a lot of our technologies that we've developed for commercial use, technology that was really developed for delivering, for delivering parcels and pizzas to now deliver healthcare. SNUCODE has 4 layers. You have the location layer for giving people addresses and finding them later on. Then you have the optimization layer. So if you have 30 mothers to vaccinate, or what's it called, 30 homes to visit for sanitation purposes, we show you how to get to those homes most efficiently. Then we have the verification layer. If you need to make sure that the community health nurse has visited every home, we use technology that I first pioneered while working in the military to make sure that people have visited these mothers while they're out there in the field. And then we have future technologies. So SNUCODE flies drones, and we are preparing for its use in driverless cars. So we're just doing a couple of programs in Liberia not less than 48 hours ago. And yeah, it's a really, really interesting position to be in right now. And I don't think we would have gotten here without the impact of the AHIA program.
Thank you so much, Seth. That's fantastic. So we have a saying, location, location, location. In your case, it's particularly strong. Can you just share a little bit about your choice, right? You have been going between London and Ghana. What do you see as the pros and cons between these sort of geographical moves, and how you support this innovation within the continent of Africa versus what you find, some of the challenges of going back and forth?
Okay, well, so when we first got funded, there was a sort of fundamental choice to make as to where to center our operations. We made the choice to center our operations in Ghana, so as to be closer to the problem. And that has had many, many advantages, and perhaps one fundamental disadvantage. So it essentially became a choice between being closer to the problem or being closer to the money. We chose to be closer to the problem. And what has resulted from that is that we have a more comprehensive solution to the problem, which is more suited for the people that we are trying to work with. To put into perspective, our sort of closest competitor in the field has had, $73 million in funding, and we who are closer to the problem have had $1 million in funding. But whenever we examine, we have to, at the risk of sounding immodest, we seem to have a better solution, better suited for the conditions that we live in. So for example, one of the things is that our technology works without the internet. So everything from location, optimization, verification, and future technologies like drones and stuff like that, all of that works without the internet. And the impact of that could be clearly seen when we were testing things out in Liberia. We were often working in places where there was no internet connection, and our system worked seamlessly. And that's really, really powerful. And we still, in retrospect, we feel that we made the right choice for the technology by developing it with local talent. And there is a lot of local talent in the right place. we are now looking at the situation where to expand, we need to increase our funding, and maybe talk to me in a few months, and we may have to also move closer to the money a little bit, because that's a sort of reality on the ground. But that's our view on the situation now. We made the right choice for the technology by moving closer to the problem.
Thank you so much, Seth. That was very helpful. I think for the audience here, we have a mix of questions. A lot of people want to know the very specifics of operating in Africa. So it's super helpful background. So thank you. Next, we have Conrad Tanku. So Conrad, will you share a little bit of your journey as same story, sort of before, during, after AHIA, and where you are currently?
Great, thanks, Amelia, and thank you, Adreni and Seth as well, for sharing your brilliant ventures. So, I mean, I'll start by saying my story is a bit atypical, right? Because I'm somebody who is very obsessed about impact, and I'm somebody who loves technology as well. And particularly GIC Med, I didn't start with creating a venture at the beginning. So, I mean, I think it was around 2016.
And Conrad, I don't think we can see you. Would you mind turning on your video so we can?
Okay, perfect.
Great.
Great.
Yes.
So nice. Okay. So yeah, so the idea came about in 2016. Before that, I co-founded a venture before, which was typically software mHealth. And yeah, I was really in the entrepreneurship space. But GIC Med was not really an idea. They need to create an venture in the future. So 2016, at that time, I was working at the front line as a medical doctor in the rural community. And there I had an encounter with one of my patients who, after referring to a city for some consultations and extra exploration, we discovered she had advanced cervical cancer. So that was a bit funny because after that, through some discussions, I discovered that almost no woman in that community had ever been screened for cervical cancer, which was strange. But I understood also because before previously, there was almost nobody with the right expertise to carry out this type of test. So some months later, I decided to do something out of my free time in the community, and I decided to organize a health campaign, a massive screening health campaign. And we decided to organize on a Saturday. And I think the bad thing is that I didn't do enough planning because I didn't evaluate the potential feedback of what I was about to do. So we organized a screening campaign, and at that time I had about 5 staff, nurses who were mostly nurse aid. And on that day, we had 250 women who turned out for screening on one day. But just to give you an idea of the context, I was the only one who could actually do the screening. So the other people were like helping me out. So you can imagine I had to screen 250 women on one day from morning to night. That was very exhausting. But it gave you an idea of how big the problem is. So because we could not satisfy everybody on the same day, we had to schedule another screening campaign. So we did the next screening campaign, and more than 150 women turned out. And yeah, the problem was there. But at that point, 2016, 2017, there was no idea of packaging these into an enterprise or a venture. So as we went along and kept on screening, news spread. And then we started receiving calls from neighboring villages to come and assist them and do screenings there as well. So it started becoming very challenging because I was the one doing the screening, and alone I could not do all of that. And now the next plan was, what can I do to really satisfy this demand? So the initial plan was to get other medical experts who could join the team, join me in the free time, and then we do the screening. But it was very challenging because I could not find other medical doctors who could be free and join me in the screening. The backup plan was to get to engage medical students. So I got in contact with some medical students, and we continue with these activities. But now they are students, and they have a tight schedule, so they cannot be available every time. It means that system was not sustainable as well. Now, the idea of trying to create a technology-oriented solution to solve this problem, that's where everything clicked. And so at the start, the technology was to solve my problem. So my problem, in the sense of permitting me to screen based on the demand, than creating a venture that will actually help women to be screened in various underserved communities. So yeah, I got in contact with some of my friends who are in the tech domain, and we drafted something. So we came up with the first venture at that time. The name of the project was ServiceScan, and we were screening all over cervical cancer. So we created a solution, and that was to help me. And summarily, this is how it worked. So basically, we were supposed to capture the data required for the screening from any remote location and then send to me at the central level so that I can review and then place a diagnosis remotely. So in that case, I could review and screen many women in a very short time, and that's going to be less stressful on myself. And yeah, so from there, the technology came out, and the first prototype was quite interesting. And there I said, well, I mean, we could do more, maybe. So there I decided to create GIC Space, that's the venture. And the mission of GIC Space is actually to bring together talents with diverse backgrounds, engineering backgrounds, legal minds, medical experts, business, you can name the rest, so that we can co-create solutions that can solve major health challenges in sub-Saharan African countries. And GICMed now became the flagship product. And yeah, we continue to see with cervical cancer, but along the line, we discovered that breast cancer is actually a bigger killer than cervical cancer, and it's equally more difficult to detect, especially in rural areas. And so, having founded the first team, we decided to start brainstorming to integrate technologies which could be adapted in our context now to spread this concept and enable women in any location and no matter their social status to have access to breast and cervical cancer screening at the point of care. So that's how GIC Med was born. And then that was 2017. Now, 2018, I got in contact with the AHIA program. And I mean, just to describe, AHIA is it's like a speed dating entrepreneurship. Like 3 days of intense screening, dissecting a project. And you can imagine somebody coming with purely technical background, medical background, and being exposed to a group of people from a business background, technical background, legal background. There was a lot I had to learn. And just like what Abiyandoun and Seth just said, IP was one of the biggest ingredients we got from there, because we had to understand that everything we were doing was new and disruptive. And with this, there's a particular importance you have to place in protecting these new ideas, especially if you want to potentially develop a project that is going to scale. And yeah, we got the idea, but now implementing was also a problem. There was a lot of things I had to learn there. I'll give another example too. It's in South Africa that I had to understand the domain of regulation and laws that apply to healthcare, for example. And it was in South Africa that I actually stood behind my laptop to find out what regulatory policies are present in Cameroon. So there was a lot to really learn, because I'll say technically we had the expertise, but packaging that into a business, we were very, very much scattered. And that's what AHIA really helped us to package. But I mean, AHIA, I would say, gave us a foundation to think, not to build, because when we came back, there's a lot of things that we still had to do a lot of research on. And I mean, I think I have an opportunity to talk again about our progress so far, but given that foundation, we had to come back and remodel a lot of things. And at the level of AHIA, we had two technologies at that time, but currently we have 5 technologies solving the same problem. So GIC Med actually is 5 different technologies packaged together to solve the problem of breast and cervical cancers at the point of care.
That's fantastic. Thank you, Conrad. That's a great journey. And in fact, you mentioned a couple of things that are very helpful. I think that it kind of triggered my thinking. The co-creating of solutions is such an important thing, and it fits very well the theme of today's panel, which is innovation and not aid. And you talk a little bit about packaging, so not just going with one sort of solution that is just maybe just funds or just this or just that. So bringing it all together is where you found, your progress going forward, right? Can you talk a little bit about what the future you see for GIC Med?
Good. So one other thing we've learned a lot is that entrepreneurship in healthcare in Africa is very, very much complicated. And I mean, the more you use words like disruptive, innovative, pioneer in your enterprise in Africa, it means you're bringing a lot of problems to yourself. Why? Because Africa, I mean, there's the first thing to fight in Africa in terms of entrepreneurship is a mindset. I'll give you guys a simple example just to maybe understand better. Related to the COVID pandemic, for example. So each of I mean, everyone attending, I mean, most of those attending, I think are from Africa. I'll give you a simple thought, right? If we're talking about rapid diagnostic tests for COVID, for example. So if tomorrow you walked into a healthcare facility and you asked for a rapid diagnostic test and they told you this test was manufactured in Burundi, for example. I mean, I have no problem with those from Burundi or from Central Africa, for example. I mean, your initial thought is going to be, truly, are you sure it works? I mean, you ask a lot of questions because of what? Because of where it comes from. But if they tell you this test is from Japan, or from the US, or from Europe, you ask no questions. You just, now you can collect the blood sample, you can do the test. So there's a lot about the mindset, and that's one of the things we've understood through our journey. No matter how much you want to disrupt and build a solution, which is context-based, the more you bring problems to yourself because you have a lot to prove and a lot to demonstrate for people to understand, then accept your solution. And based on that, for over about 1 year now, we decided to invest a lot in R&D because we understood that for solutions like this, especially which are new and created by Africans for them to be able to thrive, be implemented and scale in the African context, you have to do your best to prove on the potential impact it does. And not just by talking. I mean, talking is cheap. Everyone can talk. You need to prove and demonstrate that it actually works. And in the healthcare domain, for example, it goes through systematic and well-validated methods like carrying out a clinical trial, for example, to demonstrate that it works. So we understood a lot of this, and for 1 year now, we decided to invest a lot in R&D because we envisage that if we are able to demonstrate in an evidence-based manner through procedures which are standard like clinical trials and in partnership with organizations who are credible, that our solution does what we say it does, then we can easily implement in our context and scale to other African countries. But having understood that, the next problem is about the African ecosystem in terms of regulation, especially, and in the healthcare domain. My country, for example, as I told you, it's in South Africa. I started trying to understand how regulation in healthcare innovation is in Cameroon. They don't actually exist. And they don't exist, it's not the fault of the governments, but it's because things like this are new and there was no importance to create any accordance in the past to create organs that can be set in place to regulate innovations that are going to stem out in domains like this. So a lot still needs to be done. And that is a big limiting factor because these regulations are being drafted on an individual basis. For example, I think tomorrow with the creation of a lot of healthcare innovations in Cameroon legislation is going to come out with texts that are going to define innovation in the healthcare domain, which is good. But you're going to find out that Nigeria is going to do the same thing peculiar to Nigeria. Zimbabwe is going to do the same thing for Zimbabwe. Senegal is going to do the same thing for Senegal. That means that if you're taking an innovation from Cameroon to Nigeria, it's like you're starting through the whole process all over. You need to prove yourself from scratch every time because the regulations are not harmonized. They are different. There's no collaboration between them. And I mean, for example, in the European Union, you talk about the CE mark. And when a product has a CE mark, it's accepted in many countries. You have FDA in the US. But in Africa, we don't have things like this. The legislation is lacking, regulations are lacking, but there's a fear that they can be put in place, but don't still solve the problem because there's no harmony between them. So this, while investing a lot in research and development, we're trying to anticipate in future problems like this. And I mean, just a tip on how we think we can solve it at our level. We think if we try to put our innovations to a world-class standard, meaning that if we can get an FDA registration for our innovations, if we can get a CE mark for our innovations, it can be easy for us to diffuse them. Then developing in Africa and only keeping in mind the African context. We need to really think global, though we are trying to implement in Africa.
Excellent. Thank you, Conrad. That was great leadway into actually the general part of our panel now, which we will involve all three of you, and we'll ask some questions regarding the theme of today. So the theme of today is innovation, not aid. So let's dissect the theme a little bit. So aid really means to give help versus innovation really means to move into the future. So when we're looking at bringing complicated solutions of healthcare in Africa, there are some challenges that present themselves, you know, that can range from so I'd like to open to the question to all three of you. If you can turn your videos on, Conrad, Seth, and Dr. Abiyandoun, we can talk a little bit about these challenges. Feel free to jump in. If you are comfortable and ready to answer this question first, go ahead, or we can go around the room.
Hey, Amelia, could you repeat your question? Sorry, I think you were paused for a second, so we couldn't hear the actual question.
Oh, sure. Yes, I was just talking a little bit about in the context of the theme, innovation, not aid. There are a lot of challenges that present themselves that can range from funding to knowledge and network. And which of these spaces, individually or together, do we think are most important in the context of the theme of innovation, not aid?
Good. I think I can jump in first. I mean, like I said before, the African context is particular because almost everything is a problem. We are lacking almost in everything: funding, networking, regulation. There's a lot of things that are not yet put in place. But I mean, if you interact with most of African startups, we're going to tell you the main problem is funding. Funding because I mean, we've seen it over the years. It's very, very difficult to attract funding in Africa, especially as a local founder. And the worst of all, when you're trying to do something new, you're actually solving a problem with an interesting solution, which is innovative, disruptive. It's not good enough. It's not attractive enough. You still have to prove. And when you're proven with the basis, I mean, with some pilots that you can do it at an initial level, then you still have to prove that you can scale. And when you have proven that you can scale at a certain level, you have to prove that you can be sustained for 10 years, for 20 years. There is a challenge at every level. But now, on the other hand, despite the funding problem, accelerators and other, I mean, tech environments that permit coaching, nurturing businesses are also very valuable. But I think the importance comes especially at the early stages because related to funding, we could bypass the problem of funding at an early stage with the fact that founders could bootstrap. So if there's a possibility that founders can bootstrap at an early stage and then be in this environment where they receive the right coaching, access to the right networks, then I believe there can be a better possibility of building ventures that can have better chances of succeeding tomorrow. So funding is a big problem, but related to the challenges we are really facing, it's like I mean, a memo I'm sending to other entrepreneurs: bootstrapping at the early stage should be like the basis of your funding at the initial stages, because it's very difficult to find VC firms or early stage funding for startups. But if you can find yourself in an accelerator where you receive the right coaching, the right mentorship, access to the right network, and you can bootstrap, you can have better chances of success than just building an idea and then sitting down waiting for funds to come. That's more challenging because every stage of the process will be a challenge.
Okay. Well, yeah, to add to what Dr. Conrad said, I think this may be a little bit unorthodox, but maybe I can sort of illustrate the problem in three stories from this snooker journey. There was a time when snooker was just an idea. And, I was sort of exploring, I had done everything, including, we started off with a bit of a disadvantage, right? I had not quit school. I did not have a garage. So it wasn't this sort of classic Silicon Valley startup story. But we had, at the time, an MVP, that we could show to potential investors and stuff like that. And I came to Ghana and, I was just trying to have, conversations with potential funders in country. At the time, I spoke to the third largest telco in Ghana, and they offered $100,000 for 51% of the company, right? So that's the first story, right? $100,000 for 51% of the company, you've lost your company in your pre-seed round, right? And that's thankfully we didn't take that. I went to London 2 weeks later, had a conversation with my former employer. This was on Monday, and I remember very well we had it on Oxford Street. No, it was Carnaby Street. We had a conversation on Carnaby Street. And I spoke to him about it for about 20 minutes. He asked me to write half a page about how, what the technology was so that he could show it to his, to the CEOs and the technical leaders in his other companies. This was on a Monday. On Wednesday morning, I received an email with him offering $200,000 for 10% of the company, right? And I said yes. So that's the first story, right? The valuations and access to the right kind of funding that will keep people motivated to continue building their companies just doesn't. It just isn't around, right? We had done the bootstrapping thing and all of that. But that's where we got to. Now, the second story was from 2016, just before we joined the AHIA program. And on that occasion, again, I was in London. I'd gone to a friend's wedding, and on the sidelines, you're talking about what you're doing now and blah blah blah. And somebody introduced me to their brother-in-law who was working at a venture capital firm in London. So he invited me over, and I went in. At the time, we were looking for $400,000. So we introduced a program to him, and back then Snooker only covered Ghana. Long story short, we ended up with an offer of $3.8 million because $400,000 was off-piste for that particular firm. The firm went on to spend a further $280,000 doing due diligence. They flew people to Ghana, tried it, and they were flying all over town, all over the country, testing the technology and testing, our prototypes for other African countries. That resulted in them making the offer of $3.8 million for 64% of the company. Again, similar problem. Luckily, my investor and I saw it as a bad deal. My investor offered to come up with a further $400,000, and they wanted to do 5 more countries with $3.8 million. My investor came in with $400,000, and with that $400,000 and him trusting in me, we did every country in Africa, and South America, and the Middle East, and a little bit of Asia. And so that's the second story. And in there you have, a really big discount in terms of these are supposed to be professionals who are supposed to be able to know what is possible after understanding the company a little bit. But they clearly got it wrong, right? They wanted to spend $3.8 million in 5 countries and $400,000 did, 54 countries and more. And then the third story is around customer acquisition, which is sort of similar to what Dr. Conrad talked about earlier. When we start talking to clients, and I remember we're talking to a Pacific Island nation who we're now working for, and we're close to closing a contract with. Initially, when we spoke to them, they were all very, very hesitant until I spent a few weeks in London. And I started calling them from London with my investor. The product hadn't changed, the people hadn't changed, just the location, just the source of the call had changed. And so I consider myself lucky because I'm sort of halfway between London and Accra. But in that sort of situation, you get to really see how different life could be if we had done everything in London, right? And London isn't a particularly easy place to get funding, right? And so I can only imagine how difficult it must be for people who are entirely African-based. And I can clearly see that there's a huge, opportunity being lost by funders who discount, Africa and African innovators. Now, look, there are risks you face in Africa that you don't face anywhere else. We're currently running on solar because the power is out. We have to have two separate, two separate internet connections just to keep everything going. We have, faced, what is termed political risk and things like that. But even with an appropriate and commensurate discount for all these risks, I think African startups are being significantly underfunded, and investors are missing out. Whether they be impact investors or commercial investors, they're missing out on great opportunities. And some people might describe it in all kinds of uncharitable ways, but I think I understand, right? That it's really about what you're familiar with, right? And if you are an Ivy League, if you're a funder and you went to an Ivy League university, and you see people who are like you, it is easy to imagine that they can do what they say they can do. But if you're talking to someone who is like me, and also from the continent, it is not that easy, right? As a side note, my investor is a particularly interesting person, right? He was a partner in Ernst & Young. He never went to university. And he had seen me do amazing work for his companies before. And I think that's what, grounds my view that it's not really about, some people like to make it about race or something like that, but I think it's really about, investors, having the courage to, look at things in an unbiased way and dealing with their sort of, biases, unconscious biases when they're looking at investees. I sort of said half jokingly that maybe investors should do the implicit association test to sort of, calibrate, themselves before they start dealing with African startups. And this impacts everything, right? It's not just about financing. It's about, how much you trust the decisions that your investees are making, right? I went through 5 years without having to submit a report, right? I think we had regular conversations with my investor, and yeah, I think we've delivered in a big way for him. Yeah.
Thank you, Seth. That's great. I'd love to hear also Dr. Abiyandoun's perspective on this topic.
Yeah, so I won't like to say so much because I think Conrad and the other guys actually they've done justice to this conversation. But I would like to talk because for me, I've been on the other side. So I've spoke to VC firm, I've spoke to accelerator partners, then I've also spoke to I've had conversations on funding with big corporations, Google, Facebook, UN, and I kind of understand the way they think and what kind of inform their decision. Yeah, there's a lot of bias. We can't dispute that. There's a lot of bias, but I think rather than coming here to talk about all the problem, I think we can come here to make suggestions. And I will try to use 2 examples to really make people understand what I mean by saying rather than coming here to talk about the problem, we should make suggestions. I'm about to start building a new company in healthcare. And so currently I'm talking to a very, very prominent accelerator program in the world. I don't want to mention their name for some reason. And these people, so they say, oh, we only want to talk to founders that have had businesses that have been successful before, or even if you've not had businesses that have been successful before, you must have an MBA, you must go to an Ivy League school, etc., etc. And one of the reasons why they are doing that is that they say, oh, we have raised these funds. We have raised this funding from a lot of local investors in the US, in the UK, and we have to give them returns. And we are trying to reduce our risk by just interacting with people that we know have the expertise, right? And I kind of understand that, right? And that's one of the reasons why a lot of African startup founders we are on the disadvantaged side, because most of the time we've not gone to any Ivy League school. Most of the time we've not even had any. Most of us sometimes are first time founders. We don't have any successful business before. Most of the time we don't even have a white co-founder, because sometimes it's more easier for them to even trust the business more if there's a white co-founder on the board, or you have the white co-founding team. And so there's a joke now, a lot of my friends say, there's a joke now, a lot of my friends say, and they say, it is more easier for a white co-founder and a black founder running a business in Africa to raise more funding than black founders running the same business. And that's the truth, right? That's the truth. One of our biggest competitors, their operating expense in a year is over $20 million. And they are doing the same thing we are doing in Africa, and they raise this fund from the same set of people I've talked to before. They raised this funding from this same set of people I've talked to before, and they say they can't give me money. And I don't understand why those people, they keep giving these same guys money, and these guys stay in Boston and they say they are running the business in Africa. So it's a lot of things, right? A lot of things really affect this. And seriously, Conrad has said it. You cannot innovate without funding. That is not possible. You have to see how much Google, Apple spend on R&D every single year. So we need this funding. And that's one of the reasons why sometimes they say, oh, African businesses are not up to par with international business and the likes. I think if they can change the perspective of funding African businesses, there's going to be a change. Do you understand? And so let me use another example. Google. I've had several interactions with Google, and I have to give Google today. I'm not trying to do any PR for them, but if you're a Black founder and what you are doing makes so much sense, they will continue to partner with you, right? They will continue to partner with you. I don't know what anybody might think about them. Maybe some people feel sometimes they can be, but for my own interaction, if what you're doing makes sense, they will continue to partner with you. But not all VC firms. And the reason why it is like this is because Google is not expecting any returns on any money they give you. Is grants. Sometimes they can, and seriously, Google has even made some investment in African startups because they have so much money and they can risk money and do a lot of bets. But most of these VC firms, they don't have that deep pocket. And sometimes that's one of the reasons why they are really always very, very biased. So I want us to look at it from that angle. And I think one of the solutions I would prefer is that maybe all these VC firms should start having local companies or local offices in Africa. And these local offices in Africa, we help to essentially help them look for Black, African, not white-run African businesses that are doing so well. I mean, so I think that's one of the solutions that's in my head. But seriously, on the topic which says aid innovation, we need funding. We need aid to innovate. I mean, R&D is expensive, and without money, you cannot do any R&D. Yeah. Maybe you just do, right? So I think that's my own suggestion, and that's my own conversation around this. Yeah.
Dr. Abiyandoun. So really we have a sort of combination of partners, advocates, investors in our audience today that are listening. And so if you had to ask this audience, right, what might be one of the first steps to do in order to make, these more prosperous, more innovative advances, not just funding, not just this aid. So what would be that ask that you would ask this particular audience?
So for me, my own ask would be essentially that I think partners to be open-minded, and sometimes I think they should. Yeah, I think the other guy was talking about, not Conrad, was talking about the fact that he had to do an due diligence session with the company, and they had to fly people, spend over 300 and something thousand. They don't need to spend that much, really. They can have local people they employ in Africa to help them do due diligence. I mean, so that they can even reduce their overhead because some of them say, because of the cost of due diligence, that's why they don't even fund African startups. They can have local people that can help them do the due diligence, and they should be more open-minded to understand our process, to understand what we do, and to give us an opportunity also by giving us funding that will make us grow, not sometimes funding that would just make us run for a particular point in time, funding that will really make us grow and do amazing things. That's one of the suggestion I have, and I will have for them. I will have for people.
Thank you, Dr. Abiyandoun. I'd love to hear Seth and Dr. Conrad's thoughts on that first step.
Right. I mean, what I'll say is very simple, right? We are masters of the context. It means we understand the context perfectly. And it's all about trust. It's really about trust. If they start trusting us more, and they should, then things are going to be better for them and for us, in the sense that they can easily invest in us, and we can easily push forward our ventures and create a social impact which the ventures are creating. So it starts with that trust. And it's all about the mindset, as I said. It's there is nothing in between. Trust, change of mindset, and then it's going to be a win-win scenario, because a social impact venture, which is scaling, implies the social problem is being solved, And scaling properly means there is enough return on investment. So benefit on the side of the investment and benefit on the side of the venture. So they should trust us and get the mindset change. And I think together we can do more.
Yeah, I would also add that I think it's easy to talk about trust, but it's not something that just, appears out of thin air. And so I've been thinking a lot about, what's it called? Um, you know, the steps it would take, um, to end up with trust and so on. And, yes, I said I was half joking, but I think it's serious. I think it's really important. I think investors should take the implicit association test. It's not totally infallible, but I think it's the best tool that I know of for you to be able to look within yourself and detect your biases. And that's the first thing. Apart from that, we also want to have an investment in people. Or an investment of people. What do I mean by that? So looking back, we are a group of engineers and mathematicians who ended up building something, that ended up being very valuable. But we would not have been able to get there if, for example, my original investor was not an accountant, right? Looking back in detail at what's happened with our competitors and us, in the boardroom. I was looking at a point where, having people who would come into the business, people who the investors trust. If, for example, we had, the person doing the due diligence come into the business for a year, right? And they came along with some funding to be able to see, and be the eyes and ears and sort of mediate that sort of trust gap that investors have. That's something that I think a lot of startups will be open to, because they often need a lot of help beyond that. And I think a more concerted effort towards a rational assessment of the risk associated with investing in African startups. There is a higher risk, but if you take us versus our competitors, it's not 1 million to 73 million, right? Now with 1 million, we've been able to do, we've been able to do more than our competitors who've had 73 million. We've been able to build a technology that is stickier, that people adapt to more, that people are more willing to use, that people accept into their lives more easily. What would we have been able to do with 5 million? And so nobody in Africa is really asking, for any sort of special favors. But I think if one is able to sort of rationally, calculate and leave biases aside, and it's really difficult to accept that you have biases, but I think that's what needs to happen. And if one is able to do this and leave biases aside, you will find a lot of very interesting opportunities. Now, in the next 20 years, most of the growth in the world is going to be happening in Africa, South America, in Asia, parts of the Middle East. And if you want to be part of that, right, venture funds will need to really venture. They will need to venture outside, the Ivy League colleges. They will need to venture outside of, white males. They will need to venture outside of, certain of, Europe and America. And they would need to become experts in solving the problems for the parts of the world that are growing. We like to think of ourselves, and this is an interesting conversation that I was having with the Minister for Infrastructure in Liberia just a few days ago. We are really, the infrastructure of tomorrow. We are not bridges or roads or things like that, but we enable all of these things to happen. We enable, sanitation to happen more efficiently. We enable, a poor country to be able to run, an emergency healthcare system that is better able to deal with future pandemics, that is better able to deal with, basic healthcare needs of people at a more reasonable price, because the technology is that much better and that much cheaper. And in order to be part of that, I think, there has to be some sort of fundamental changes in the way African startups are assessed. You look at the way, I look at the way the things that we've been asked to do so far, and I'm almost left with asking, wait, you want me to build a product, get traction, have revenue, have good profits before you invest? Then you're not a venture capital firm, right? And I have colleagues who have started startups, right, in Europe and in America now. And they look at the requirements from the same venture firms that they're talking to, and they're like, this is ridiculous, right? And I think that realization has to come home. And I think there are great rewards for the people who will make those changes first and more far-reachingly.
Thanks, Seth. And that's actually a great segue into sort of our last question, which is, we have an audience. In addition to these investors, there's also a lot of young entrepreneurs, aspiring entrepreneurs that are looking at creating these solutions to these complex sort of healthcare and life science problems. What would you tell, this audience? You were in that place earlier. What are some of the learnings that all three of you have kind of taken through this journey of ups and downs and can pass on to this audience of, future entrepreneurs or, current entrepreneurs?
Yeah, so for me, my own learnings really has been around partnership matters. And your first ever funding that you will get is an opener to other opportunities that will come your way. So you have to really, really, really leverage on it. And when you start getting funding, make sure that you build good partnership with them. I mean, it's not just about funding. Make sure you good partnership with them. I mean, we want the Google Impact, I will use myself as an example. We won the Google Impact Challenge in 2018, but I've been constantly updating Google about the progress of what we've been doing. And when a new opportunity came up for developing new solution in AI, they wrote to me that, oh, are you interested? And we started working on it. And now we've gotten another partnership with them for funding also. So it's important you understand you got funding from this organization and you just feel that, oh, that's the end. No, that's not the end. Still kind of interact with them, provide updates to them. And I mean, something else might come out of that. And the second thing I would say, and the last thing I will say, is that be a good and a very trustworthy person. I mean, one of the things I also see that is also very, very, very prominent among young entrepreneurs coming up is that people now lie about their numbers. Like and sometimes they do that thinking that, oh, if they do that, they might be able to have access to more funding. It makes an investor more excited and all those things. All those things, yeah, you might really get away with it. But on the long term, it's going to have a very, very big ripple effect on your organization, which is very, very devastating and bad. So I would advise that a trustworthy person, tell people the truth. The good thing is that when you tell people the truth, people that will fund you, people that won't fund you. Even when you tell people, when you lie to people, people that will fund you, and people that won't fund you. So, I mean, and being truthful really helps, because don't put yourself in a position when you say something and you announce that you win it, and they are now doing the due diligence and they find out that you lied. I mean, it's a big bad reputation on your side. So that's the two things I'm going to mention for people that are starting up. And I pray the odds and God continue to be with you. Thank you.
Thank you. Great. I'd love to hear also, Conrad, if you have some thoughts.
Great. I mean, I have two keywords, right? The first is passion and the next is impact. And I mean, the starting point is in many things is usually zero. But I just want to let entrepreneurs in Africa know that in Africa, by default, you don't start from zero. You start from maybe negative 100, because everything is difficult at every stage, and especially the beginning. And I mean, that linked to my philosophy, I like taking negative answers or rejections as a challenge. I'm somebody who likes to prove people wrong. So, I mean, I give an example. If you want to invest in me and along the line you pull out because of one or two reasons, I'll prove you wrong. I mean, I'll put it as a challenge to build my business to prove you wrong. And I think that's linked to the passion I have towards the business, because things are going to be very difficult. Things are going to be very rough. But the only thing that is going to make you stick to what you're doing, or stick to your mission and your vision, is just your passion about what you're doing. So that's what should give you the energy that should surround what you're building. Because if you cannot withstand the challenges, especially at the early stage, the challenges you face, then you should not be an entrepreneur, because it's just a start of many more challenges that are going to come up. So you are supposed to really build that passion around what you're doing, and I mean, learn to prove people wrong. Never take a rejection with a lot of grievance. Put it as a challenge to prove people wrong.
Very powerful. Thank you. Passion and impact and trust. And Seth, do you have any last closing on this advice for founders?
Yeah, so there are two things, and they're sort of related. I think you should be, if I was doing this again, I would really work hard on finding a partner. And you don't, this is not something that that is easy to do on your own. It can be a very lonely, existence. And lonely not in the sense that you don't have people around you. You have people around you, but they're literally not in the same world as you. They're sitting right next to you, but they're not, they're not in the same place. And so finding a partner from the beginning would be very interesting. Would be an advice I'll give to everyone. And also trying to dig at the reasons, right? And they're not necessarily negative reasons. They're often just human reasons, right? Why people do the things they do. And this is important when it comes to, external parties and customers. You need to solve the problem that the people have, not the problem that you imagine that they do. And so, and this is interesting because sometimes people have a real problem. It could be, for example, sanitation, right? But the method, their biggest motivator to solve that problem may not be what you think it should be, right? Their biggest motivator to solve that problem may be something totally different. It could be status. It could be, it could be status. It could be as weird as status, right? And what I talk about is we did some projects some time ago for sanitation. And, it was about on the face of it, it looked like, you clean your place up, people will live longer because they don't get cholera and stuff like that. But no, what ended up changing things was building building toilets that were, seems strange to use the word, desirable, toilets that almost became a status symbol, right? And that worked. And I spent a lot of time being sort of miffed about it, because these people didn't, was looking down and saying these people don't care about, whether they live or die, but they care about their status in society. And I think at the end of the day, it doesn't matter. I think what matters is solving the problem, understanding the deep emotional needs that people have, for belonging, for acceptance, and all sorts of weird things. And I think the doctors will agree with me that, a lot of times when you see somebody behaving irrationally, and if you ever get a chance to dig deep, there is often an emotional component to that. And I think in terms of, your sort of personal vision and progress, I think that's kind of key, being open to learning about those things.
Thank you. Those were very powerful and wise words. Understand the problem at the matter of it, not just how that problem is imagined. Thank you. So that is a fantastic way to close this session. I would like to bring on Angela and to do some closing remarks, but thank you again to all three of you. This has been incredibly insightful, and I hope people in the audience have taken notes, because there's incredible power in how we can move forward. So thank you again. And Angela, on to you.
Thank you, Amelia. And wow, just wow. Thank you to all of our panelists for those insightful remarks. I've learned so much. I started putting little notes in the chat, so I hope everybody enjoyed that. Just so much context, from context matters to trust, passion, and impact. Yes, thank you so much. So with that, we'll start the wrap up. Thank you everybody for joining us for AHIA's third webinar. This webinar is a part of our Biomedical Innovator series. And as you can tell, or I hope you can tell, all of those panelists were past AHIA participants. We want to make sure, we as an AHIA, we want to make sure that we are assisting in building the next, the future of Africa. And we do that through helping innovators, like you saw in the past hour and a half, build out their problems, connect them, provide educational resources, opportunities as we can. So please join our listserv. I think the way to join it is the link. After you leave this webinar, you'll receive a link for the post survey, and you'll have a question among many that would say, are you interested in joining our listserv? It's important for you to join our network so you can see all the future events from AHIA and our partners, opportunities, and just connecting with us so we can learn how to assist you in your innovator journey if you are one, or interested in assisting another innovator. And we want to hear from you. So as I said, right after this, you'll receive a link to our post-webinar survey, which will take less than 5 minutes to fill out. And it'll help us narrow down just topics for future digital programming, and narrow ways to support different journeys in just this sustainable innovation theme. And also you'll be able to stay updated with AHIA and our partners events, as I said. And please connect with all the innovators through LinkedIn and Instagram, Health Moms, Snoop Code, GIC Med. Their LinkedIns are as their name stated. So please find them on LinkedIn and connect with them, follow them, Instagram as well. And connect with AHIA on our LinkedIn and Facebook page, and visit the Bioaxa resource page, which will drop the link as well so you can be updated. So thank you again for joining. If you have any questions, any connections, anything of this matter, feel free to email us at ahia@emory.edu. And for one more plugin, follow us on LinkedIn, join us on LinkedIn for more resources and news for any support for potential healthcare innovation in your region. we're so excited to connect with you. Again, thank you so much for joining us in your day, and I hope that you've got as much knowledge and insights as I've gotten. So stay tuned for that post-survey link and more stuff from AHIA. Thank you, and I hope everybody has an amazing day. Bye.
Thank you for having us.